Town. I'm Darrell Gordon, your host, and I'm sitting here today with Dave McCarty, a certified healthcare consultant, and he's with DMC Group, and we're going to talk a little bit about the number one reason for bankruptcy. Believe it or not, it's healthcare cost. So Dave, it's a pleasure to have you on the show today, and we really let's talk a little bit about this bankruptcy issue and how it's affecting our economy. And you know, if I was talking to you 10 years ago, the number one reason for bankruptcy wouldn't be healthcare cost, but it seems to be something that's prevalent today, and it's causing significant issues with many of our families. And as you know, when you affect the parents, it affects the kids, and then affects the economy and everything else. So let's talk about, you know, seniors that are experiencing these bankruptcy issues and the healthcare costs. What are some of the characteristics that translate into healthcare costs that balloons, and now you're thinking about filing for bankruptcy? Let's talk a little bit about fear. How does that affect our seniors?
Yes, Darrell, I appreciate it. My passion for addressing this subject comes from having been a nursing home administrator, and people coming into my office in tears that they were about to lose their life savings and even their home. And healthcare costs are the number one reason. So many of America thinks that they're covered by healthcare insurance, and actually almost 40% of those folks that are going bankrupt had healthcare insurance. So they were covered, but all of a sudden when a crisis hit, they were bombarded by excessive costs and nowhere to go.
So when you talk about the excessive costs, you got to talk about fear.
Yes, you do.
The unknown. What are they fearing?
Yes, sir. It's the ability to survive and to be responsible. There's a big emphasis among the elderly in particular of being responsible and being independent.
Yes.
And the healthcare environment nowadays makes us helpless in a sense, both financially and physically. And so the fear of what the future is going to offer, the fear of not being able to provide, and of not being able to be independent any longer.
So when you talk about the fear, you probably also got to talk about the anger.
Yeah.
You know, so I mean, there are some people just angry about this whole process. Tell us a little bit about that.
Yes, there are, and that sometimes is the most difficult issue to get around, is that anger, and sometimes the messenger is viewed as the bad guy, but my attempt is to get out and educate, in particular the middle class, which appears to be disappearing in regards to health care and bankruptcy. And so to outline different planning procedures and mechanisms that they can put in place to protect their assets down the road and to adequately address government benefits and private health care both.
You know, is it fair to say that there is some guilt also going around and circulating with our seniors as it relates to this bankruptcy process?
There is, Darrell, and that in particular is with regard to not utilizing government benefits and the shame that is the old-time point of view, the shame of being on Medicaid. But quite honestly, my attempts to address that emphasize that it's happening to people that used to think they were well off. When health care in a nursing home costs on average $100,000 a year, it's easy to go from a comfortable retirement to a bankrupt situation almost overnight.
You also, you talk about these, the government support in dealing with those complex issues. It's the complex benefits that the governments provide, and how can anyone even navigate through all of that? I mean, that's anxiety and stress all in itself.
Good point, Darrell. And again, when I do my presentations, I offer a free hour of consult in regards to Medicare. Having worked for Medicare at one point, I am very willing to address that and to help people understand in common language exactly what's happening and what their options are with regard to Medicare and Medicaid and other government benefits.
You know, again, you talked about some of these folks have been very affluent.
Yes.
And all of a sudden your life savings is wiped away. Do you find a lot of seniors now that fall into depression of some sort? And do you see some seniors even have to move out of their respective, you know, nursing homes?
Yes, I do. It's very sad in that regard, not only for the working population that is oftentimes forced into unemployment and in relation to health care, but in particular the seniors who have worked all their life and have saved, and all of a sudden, due to a health crisis, the table is turned upside down on them. And depression and anger, all of those are elements of what normally would be considered adjusting to death in the family. Mm-hmm. Those stages that one goes through, the guilt, the depression, the anger, and finally, hopefully, the resolve.
Well, when you talk about all of these issues that are elderly or seriously experiencing and going through. Let's change gears a little bit about resolutions.
Yes.
And how can we help them through the fear, the anger, the guilt, depression? And I do know there's one of the organizations called the Next Step Beyond 50. Share a little bit about that organization, its programs.
Yes, thank you. Next Steps Beyond 50 is a nonprofit speakers bureau. And we are comprised of individuals such as myself. I'm the healthcare expert, but we've also got a number of individuals in the legal area and the financial planning and home health care agency, and even a few fun topics like travel for seniors. But that organization of individuals was handpicked for persons having not only experience with seniors, but also the compassion and the heart for serving that population that is very necessary.
And are they required to be a senior to participate in this respective program?
No, as long as they've got the experience and the heartfelt passion to address senior issues. The Speakers Bureau, the nextstepsbeyond50.com, is an umbrella of services for seniors that can help address the fear and the planning issues that they're faced with in today's environment.
We also talk about planning for the unknown, and our healthcare situation is probably considered the unknown.
Yes.
How does one prepare for the unknown?
By planning and identifying risk in particular, Daryl, and taking the necessary action to put that plan in place. And the most frustrating thing for me is when people come to me too late. Mm-hmm. They're already in a nursing home. The best I can offer at that point is advocacy and patient rights, and possibly a little bit of understanding with regard to Medicare, but really it boils down into looking far enough down the road to do some planning before it's too late.
Well, when you talk about this issue as it relates to the unknown,
yes.
You also got to talk about minimizing the financial risk.
Yes.
Right. And the question is, how can one begin to do that? How do you minimize your financial risk in dealing with healthcare costs? And because you don't know when it's going to present itself.
You're exactly right, and it can be very complicated. As a matter of fact, there are many attorneys that will specialize in that area, and the attorney that we have is very competent in estate planning. But it is more so dependent on planning and being able to put that plan in action. And so seniors in particular can have a proactive kind of approach to their aging issues.
So when you talk about the financial risk, are you talking about home equity income being available to them, perhaps? Or, you're talking about, legal resources being available to them?
All of those things, and actually a good point in regards to home and home equity. One of the people that are on our Speakers Bureau addresses topics within the idea of a reverse mortgage and the possibility of that becoming a source of relief from financial pressures, and being able to avoid the possibility of Medicaid stepping in and taking all your assets, and so planning in that regard is very important. And myself and an attorney and a financial planner and the reverse mortgage are very good at that. And then on the care side of it, the nurse consultant that we have available and the home health care services that we have available are also important.
Well, you got to be talking about options and what options are available to you. What choices do I have as a senior to navigate through these healthcare costs? And some of the things that we talk about is the guidance of the healthcare resources. What resources are available and placements are available. Talk to me a little bit about the choices that a senior would have available to them.
Okay. Well, unlike seniors, a young person, their biggest risk is accident and critical illness. For a senior, their biggest financial risk is long-term care. And the major financial resources for long-term care are, number one, Medicaid, number two, if you can afford to self-pay, number three, long-term care insurance. But a fourth one, also a little-known benefit, a VA benefit called the aging benefit for the VA healthcare program is available as well for financing.
If I'm struggling with this process, David, and I need to mediate, I need some support in helping justify the healthcare costs, is there anything I can do?
As far as mediation, it's very beneficial and very effective for a nurse consultant to mediate anything that has to do with healthcare delivery. As far as mediating with healthcare facility and provider expenses, myself, I'm very accomplished at being able to mediate healthcare costs and find the cheapest procedures out there in the community, such that that financial strain can be alleviated or mediated if necessary.
Somebody needs to get a hold of you, 1-800-919-2676.
Yes, sir.
For support. Again, 1-800-919-2676. David McCarty, you've been fabulous. Thank you so much for the work you do for our seniors.
It's my pleasure.
Thank you all for watching Joy in Our Town. See you next time.